in this study, we wanted to focus in patients that are the sickest, the folks with critical limb ischemia, those that had the ulcers and the gangrene and rest pain. And we wanted to really understand what was happening to these patients in the last 10 years and how was the outcome different from the two approaches in revascularizing these patients. This is a study of the national inpatient sample of 650,000 patients with critical limb ischemia. These are folks that have rest pain, ulcers, or gangrene. And the study basically looked at the last decade, looking at the rates of admission of these patients. And in doing so, we also compared two types of revascularization for these patients. We compared endovascular revascularization to open surgical revascularization. And our endpoints were all-cause mortality, cost of the treatment, length of stay, and amputation rate. And we showed that compared to open surgical revascularization, the patients that underwent endovascular had lower mortality, had lower length of stay, and had lower cost. Importantly, in the manuscript, we also showed that the patients are much more comorbid. So if you look at the comorbidities of these patients over the last decade, you see that there are increasing number of diabetes, much more rates of hypertension, higher prevalence of hyperlipidemia, so much sicker patients, but yet endovascular approach did better than open surgery. And overall, in the decade of this study, the rates of mortality is going down, the rates of amputations are going down. So we are doing a better job of helping folks live longer and also have less amputation. The clinical implications are obviously, I think, are significant in a sense that we have identified an approach that may be, at least in short term, better than the surgical approach for majority of the patients. We have also highlighted some important findings. For example, we showed that African Americans were less likely to get revascularized. They were more likely to undergo amputation. We showed that the patients in the last decade are getting sicker. As I mentioned earlier, they have higher prevalence of diabetes, much more obesity, a higher prevalence of hypertension, hyperlipidemia. So we are dealing with sicker group of patients. We are showing that there is disparities both geographically and racial-wise with the African Americans. And we are showing, despite the bad news in that sense, we are showing some good news that yes, the rates of amputations are decreasing, mortality is decreasing, but obviously there's a lot more room to work, and this is a group of patients that are at high risk, and that there is a lot more we can offer them to decrease their morbidity and mortality.